I thought we don't do the three-germ layer already, am I right? No? Okay. Let's move fast. All right, what you're looking right here is what you look like about 16 days to 20 days after conception occur. At this period, we call them the three-germ layer. You look nothing like human. What you have right at that point is just a puddle or the group of tissue together. However, even at this time, they are highly organized already. So from this view right here, let me bring up the structure. So the embryo right now is in the embryonic sac, okay? And here's the sac right here. Okay, that is the fluid. And this is the future you right here, and then the your sac right here. Okay, at this time, the tissue organized into three layers, and the name tells you where they are already. The blue color right there is called the ectoderm, the outermost layer. Okay, the brown color right here is called the mesoderm, and then the yellow color is called endoderm. So you can see the term literally means the outside, the middle, and the inside. Okay, that's why they call it the three-germ layer. What's significant right now is the tissue from each of those layers have already destined to their final destination. For example, the epithelial tissue derived from all three layers, ectoderm, mesoderm, and endoderm, where the nerve tissue only derived from the ectoderm. Okay, and the mesoderm, in addition to give rise to the epithelium, it also gives rise to connective and muscle as well. What's significant is this, and that's why when a female who are pregnant, okay, the doctor always say that whatever that normal medication you take or what kind of product you put on your body, either it's a lotion, either over-the-counter medication, make sure that you talk to the doctor because at this point, for example, there is one chemical in the lotion that actually damages the outer layer, which the female does not know. So they put on the lotion all the time, right? But in this case, that chemical infected the function of the layer, the other one, the ectoderm. What could happen? The entire nervous system will not develop. Or it develop, but they're missing a brain, they're missing a nerve. Okay, because at that point, those cells are very sensitive. Are you with me so far? And that's why they call them three-germ layer. You need to know that. And this is where, okay, if you get pregnant, you have to talk to your doctor because whatever you do, you have to know this. Okay, most of the time we run into is how do you guys know you're pregnant? You miss the first period, which literally could mean that you are pregnant a month already. So during that month, whatever you do, drink alcohol, do something, the effect is already there. And that's why it's very critical to know your body, and this is where the effect is the most. Okay, we call it the three-germ layer. And what tissue came from that? We know later. You should know the tissue. We have formed into the tissue, right? Okay. If I ask you, what tissue came from all three-germ layers? The answer is epithelium. What tissue only gives rise to another tissue? The ectoderm. What layer only gives rise to epithelium? No. You better be kidding me, you did wrong. Right? Which layer only gives rise to epithelium? The answer is the endoderm. Right? Those are the things I want to expect you guys to understand this because this is how all the tissue derive. And here are some of the disorders that tell you why you should care about this class, why you should know your body, because there's little thing missing. Remember what unique feature about connective tissue? It has the extracellular matrix, right? And that extracellular matrix made up of what? If I ask you what made up the extracellular matrix, the answer should be a bunch of fibers and ground substance, right? Okay, and can you name the three fibers that make up the connective tissue? Collagen, elastic, and reticulum. And what happens if the collagen fiber, okay, that either they are not produced correctly or they malfunction in some kind of weak, what could happen? The common condition where we learn that you're kind of common and that directly associated with the vitamin C deficiency. Okay, this is one reason why people who have found a history of certain kind of disease have to take the vitamin supplement This is why when you're a young kid, right? Not to say when they're young, they need to take vitamin gummy bear, whatever they have right there. Okay, because vitamin C is a major chemical that contributes for the production of collagen. Okay, what happens if you deficiency in vitamin C? You produce non-function or weak collagen fiber. So first you see right here, okay, the disease we call scurvy or scoliosis, that's really the chemical name, the scientific name. Okay, right here. You may not know this, but at the base of your upper jaw or lower jaw, the teeth actually embedded inside and stabilized by the ligament. The strong stabilized. You know that when you pull your teeth, it's not easy to pull your teeth out, isn't it? This individual, because collagen are so weak, okay, the teeth are anchored into the bone correctly. I literally can hold like this, set it, and pull it right out. Okay, and that's one of the conditions may cause if you have deficiency in collagen fiber or vitamin C. In some other minor appearance, see right here? Okay, anytime you have a hair follicle sticking out, underneath there is a collagen fiber stabilizer. You'll have enough, they're almost like a wrinkle. They pull it inside and then they push the hair follicle up, and that's why your skin, every time you see a hair follicle, little parts right there show up because of that. In this case, it doesn't cause any detrimental, but do you want to have that skin, especially female? That's of course not. Okay, that's one small thing. This is the big thing. Okay, this individual suffer a genetic condition. We call them Marfan syndrome. In a Marfan syndrome, what causes it? The connective tissue in general, are not formed correctly in general. And you will see that it's not just collagen fiber. Therefore, the effect is no longer located at the area that associated with collagen fiber. The effect is like skeletal system, cardiovascular system, and in some case, the visual system as well. Very common people have this disease. Okay, they have a long lip finger, and I put it right here. You see, that's different right there. The condition we call arachnodactyly. Arachnodactyly means long lips, excuse me, long digit. Okay, really good, you cannot miss that. We also find out that in addition, okay, to the long finger and toe, they also have the thoracic case, the skeletal structure, malformed. When it malformed, then condition like it. The term pectus excavator means that the 17 text, another word that is just like here, the sternum, is supposed to on the side, they hollow in. It literally calling it a 17 text. Okay, the reverse is pectus clinator. Another word that is bulging out. You see bulging out right there? Okay, and see the hollow in right there? Okay, those conditions form because the connective tissue, which is bone, one of them, does not form correctly. And those people, they have a miserable life. Can you see that? That guy right there is only 35 years old. Okay? And you think your life is tough. He had to walk like that when he's born. Until he's 35, he passed away a couple years later. Okay? Commonly, death occurs before you reach 50. Just because one of the tissue does not form correctly. These are the terms that I mentioned a couple of times, but right now let's go back because we learned them already. The first one is the term metaplasia. The term metaplasia means that your tissue type can change depends on what condition you may have. Okay, one more time, let me be proud. What tissue we learned that we actually spent almost 20 minutes talking about, the tissue that lies in your trachea, where I talk about the pack of cigarettes, remember that? What tissue is that? What tissue lies in your trachea? Come on, the most famous one. Pseudo stratified ciliate columna. Remember that? Right? Okay, if you smoke long enough, that tissue is no longer stay pseudo-stratified, it will become non-keratinized stratified squamous. And now you know how detrimental that is, because now the cilia no longer have effect, right? This tissue just functions as a multiple layer, and that factor contribute to the lung disease because of that. Okay, here's another example. Chronic acid reflux. Are you familiar with the term GERD? G-E-R-D? Oh, of course you do. Good. Mean that you have German origin. The following on kidding. Okay, GERD stands for gastrointestinal regurgitation disease. Okay, it's a group of disease. One of them is the chronic acid reflux. Okay, remember what we learned here? I told you guys how acidic it is that the juice released from your stomach. You know that? Right? That's what you learn later in U2. When food enters your stomach, there is an energy door, they close. The acid door, they close. Why? What happens in the status? So what what happened in the stomach will stay in the stomach because do you want that acidic juice released anywhere else? And you see stomach eliminator, the stomach is designed to withstand that, right? And that's why I call them close the door so the acid doesn't go anywhere. But sometimes it does. The most common one is they regurgitate up into the esophagus. And commonly you have a heartburn, just slightly. The heartburn tells you how acidic it is. That's where that gastric juice that gets your stomach. Well, some people have that concurrently. I mean, every time I have a meal, okay, it will regurgitate it. There's another disease that we call bulimia. Heard before? Bulimia is a common disease with that both components, psychological and theological as well, where the parent would not notice. Why is that? Because when you go to the doctor and doctor say your child is malnutrition, you say, no, what do you mean? Every time we have family dinner, she always there with me. How can that be? And what they don't know is after the big meal, this individual ate with the family, they go to the bathroom and stick their finger into the throat to regurgitate it out. They vomit. That's why family does not know. That's why it's in malnutrition because the stomach doesn't have a time to absorb anything. Make sense? But you cannot lie by the physical science. We spot it right away because one common thing occurs is their teeth are rotten at the base. And why the teeth is rotten? That regurgitation in the stomach, you cannot, can you see how acid it is? It rotten away the base of the teeth and you cannot lie with it. That's right there. Okay? That's where if you does that, what type of teaching do you think lies in your esophagus? The answer is to stratified clearance, right? You want thick layer. Well, after you regurgitate long here, it turns into simple columnar. So those are the ones we call metaplasia. The tissue are changing caused by injury or certain type of disease. Now, have you heard about hypertrophy and hypoplasia? I thought we did, right? Right? The difference between two. So what's the difference? It might liver enlarge. It can enlarge by two ways. It can enlarge by increase the number of cells. It can enlarge by increase the size of the cell. Which one you know it is, right? Hypertrophy and hypoplasia. Well, the new term is neoplasia. The term plasia tells you that the number of cells increase, right? What does neo mean? Neo means that this structure are the new one. For example, so if this is your liver, okay, if your liver enlarge, and it can be large because the cells are bigger or you have more cells. Are you with me? The difference between neoplasia and hyperplasia is this. This is your liver, and suddenly you have this. Okay, so structure is not there before. That's what the term neo means. Neo means new. So this one is a new mass. Okay, and this potentially can develop into tumor. Sometimes they stop, or sometimes they develop. We call that neoplasia. Atrophy is the opposite of hypertrophy. Hypertrophy means the cell increase in size. Atrophy means the cell shrink in size. And they are usually occur in the tissue that you don't use. The most common example of that is your muscle. The muscle that you don't use, okay, it will shrink, and you can see the evidence that easily in people who are colorblind, either wrist down or paraplegic. Okay. Necrosis is another term. Necrosis, very simple, means the tissue are dead. Okay, either by injury or either by the disease. Okay. However, necrosis, there are many different types that can occur, and that's why I give you this slide right here. Talk about the condition that's very common in music, we call gangrene. Okay, gangrene caused by different types of infection or caused by the hostile environment as well. Instead, you guys, let me show you three types of gangrene. Okay, first we have dry, wet, and gas. Do you remember? Dry gangrene. Very common when you expose your body surface into the extreme cold environment for a long period of time. For example, you are trapped under the avalanche, you climb up Mountain Everest and you stay there for about a couple of days. What happens by choice or by none of your control? If you expose your skin to the cold environment, those tissue will be dead. And in your body, very clever. If we had to lose some tissue, we decide to lose the tissue that locates further away from the body. We keep the core intact. Make sense? That's why your nose may come up, your peanut may come up, your finger may come up, and what we call that is the frostbite. Okay, and here is the element of the frostbite. Can you see this? What is that? Inflammation, right? Or signs of inflammation. Or sign of symptom of inflammation. redness, swelling, pain, and heat. Okay, you see right there. Oh, that's actually important. I can see them from this distance, right? Okay, that's a frostbite. Okay, and most of the case, there's no treatment. We just dump when they die and we save the rest of them. Okay, now the next one is called the wet gangrene. Why is that? Which is still different from the frostbite. They are caused by the bacterial infection. Okay, and in this case, the bacterial infection, they eat into your flesh and your tissue is dying, and that's why it appears to be literally moist and wet right here. Now, the major antibiotic that we use to treat gangrene is the most common one that every time we have something wrong, the dentist also give you as well. What is a common antibiotic? Penicillin. Well, penicillin is a big field. Under penicillin, we have different types. The most common one you may heard about is amoxicillin. When you have kid or dentist, something wrong with you, they give you amoxicillin because broad spectrum. However, they have to determine what bacteria because you may have other antibiotics that specifically treat the bacteria as well. So in this case, the broad spectrum is the choice. Compare that to the gangrene. And can you see the appearance difference right there? In this case, the bacteria, the different type of bacteria is so unique. When this bacteria metabolize and eat your flesh, it produces gas. Just like we produce gas, the good news is that we release our gas there the way we release them. But in this case, the gas accumulates in those little pockets right there. You see that? Okay, and now because of that presentation, the doctor say, oh, I have to use a different type of antibiotic because this is a different bacteria. So just show you guys what happened when the tissue is injured. This is a few things that you just know about. Make sure you know the difference between the three gangrene: wet, gas, and dry. All right. So the last two slides, I don't have to cover because from now on, okay, the next chapter we go into the first organ system, and then during that chapter, I will tell you the anatomy, and then I tell you the fascinating physiology, how they function, and then when I conclude the chapter, I always bring you back to reality. This is what happens in your tissue and organ system as we age, because we cannot live forever, you guys, right? And you can age gracefully because you're taking care of your body right now. How often I see people who 55 years old into the clinic and say, I wish I know that I shouldn't have done that. I couldn't do this, right? Okay? Well, that's why I say you guys knowledge is power. Take care of your body right now. We all age, but you don't have to be on the cane when you are 65. You still walk slowly, you still age, but still healthy. That should be the clue. Declining collagen, tissue repair, take longer time to repair, all the common things that you know, so on. That should conclude this chapter. All right, we move right on into the integumentary system. Okay, how many organ systems are there in our body? No, 11. So if I say, can you take out the paper, can you list all 12 or 11? Don't say to me. Right now you should, right? That's material in chapter 1. You have to be test over that, right? Okay. So integument system is the first organ system that we're going to cover in today. Now, if somebody asks you, what the heck is integumentary? The answer is very simple, your skin system. Because a major organ, what is the organ system definition? A group of organs that work together to carry out specific function. And skin is the largest organ in your body. So literally you can substitute the term integumentary system for skin system. So here we go. Okay, the slide shows you the histology in the class we put a skin right here. We'll go into detail in a minute. All right, your integument system, major system in your body, the major organ is the skin. In addition to the skin, we have other organs that found in your skin as well. We call them the derivative. Okay, that include nail or hair, sweat gland, and oil gland, which is known as sebaceous gland. Okay. Some textbooks instead use the term integumentary, they use the term cutaneous membrane. It's the same thing. It's so important. Your skin are so complex that we have the entire brand of medicine that actually deal only with your skin, and that is called dermatology. Okay. Remember, anything wrong with you, you have to see your primary physician first. After there's something wrong with you, and it needs to be, then we send you specialists, where it take a long time to make an appointment. It costs more. Okay. However, they make much more money than the family physician. You know that. And that's why I always argue with my family member, where when they enter medical school, they always say that, why do you want medical school? I'm a doctor. Good. Why do you become a doctor? I want to help people. That's noble, right? And then when they finish, what field do you choose? I choose the field that make a lot of money, not people. Okay, and that's why we have a very shortage of family physician, not specialists. Because family physician pay the lowest in all doctor. But you think about this. They have to know everything. Am I correct? Because they are the first thing you see, right? So you see the eye doctor, should you see the liver doctor, the stomach doctor, are you with me? They feel like that. That's why they have to know everything. Where the dermatologist, they only know one thing, your skin, inside out, upside down, all detail. Okay? And that's why nowadays, you probably heard that some rural area, they're so desperate for physician, they actually pay for the entire creation. With a catch. What's the catch? 5 years with them. Okay? Work 5 years with them. And that's it, because they want to come back. And I will tell you this, 5 years, and you have the medical education pay off, that's almost like a dream. So why don't people take that? So because 5 years, yes, we pay, right? The salary is still lower than non-physician. That's why all the specialty, you don't see dermatologists in you know that Paris, Texas. I didn't know such a thing. I thought Paris is in France, right? No, it's in Texas. Where is it? I have no clue. I know for sure what it is. You can't know dermatology there. Right? They don't have me there. You understand? So you gotta feel this. Are you sure LI is what you're going to? Are you sure you want people? Right? Because I saw the nurse come in when the patient is talking about something that's the patient's face on his face. He just ran the whole thing and said, what the heck is with you? I'm done. They walk right out. Though people do not know what they're facing when they enter medicine. You understand? And yes, you help them. Okay? You risk a lot of help them. They may keep you. They may spit at you. They don't appreciate that. But that's your response. I talked about a long time ago, so make sure you know that. Get back to this. Okay, that's maybe why we behind. Okay. Okay, so again, you see all objectives, so now we go into the intelligence system. Okay, and we mentioned already that the intelligence system are your first line of defense, and that's why if I take your skin and skin up from the body and weight that skin component, it weighs about 7 to 8% of the total body weight. Okay, that's all. However, the area is the one also, especially when you measure any inches of your body surface, that means the skin is there to protect you. However, the skin is not that thick in that. The skin thickness ranges from 1.5 millimeter to 4 millimeters. Not much, but man, that is your first line of defense. And you will see later that many wonderful things occur in your skin. Okay, how many major tissues do we have? We know that now we can name 4, right? Epithelium, connective muscle, and nervous. All four of them will be found in your skin. At the end of this chapter, I will ask you the question, and I hope you get the answer. I ask you, you learn that there are all four tissues found in your skin, right? Can you tell me a specific example of each of those tissues in your skin? Pick nervous tissue. What structure is nervous tissue? What structure epithelium, and so on. So we are about to go there. All right. Your intestinal system made up by 2 layers, not 3. I have some clue when I study it so wrong. Okay, because I study the outer layer is called epidermis. Okay, the middle layer is called dermis. And then there's the layer deepest of all, we call hypodermis or subcutaneous. Okay, then top is 3 layers. Make sure you know that. No. Your intestinal system makes up only 2. The epidermis and the dermis. The hypodermis are the structure that anchor your intestinal system in the internal structure. They are not considered the layer of your intestinal system. All right. And you see the in general idea right now, the type of tissue that predominantly make up the epidermis is the squamous. You learn from the location in tissue chapter already. And the major tissue that make up the dermis is the connective tissue, specifically dense and irregular. All right. Subcutaneous, as I mentioned, also known as hypodermis, not part of the intestinal system. Before we go into detail, let's show you an overview. From this picture, can you recognize the difference between the dermis and the epidermis? Answer is yes. Okay, follow right this point. That is the border right here. Okay, that is the border of epidermis and dermis. Okay, and hypodermis, which is not a part of the intestinal system right here. cell build-up in the hypodermis because that's where you see big blood vessel. Okay, there you also see fat accumulation. We look jumpy because fat accumulation in that layer right there. So what we learn right now is go into the epidermis, study that layer first, and then after that we move on into the dermis. And here we go. Now, the major tissue that found in the epidermis is stratified squamous. And remember that you have two types, keratinized and non-keratinized. Which one do you think makes up your skin? The keratinized, right? Now, tissue is a group of cells, isn't it? Predominantly the type of cell that found in your epidermis, they are called keratinocytes. Keratinocyte. Well, the name is appropriate because the cell that make up the stratified squamous, okay, they release keratin, and that's why we call those cells keratinocyte. The cell that release keratin, which is the most abundant type of cell in the epidermis. Internal epidermis divided into different layers. We call them strata, single stratum, which means strata plural, stratum single. And here's how the way they organize. Right now, just name the layer for now. Okay? Inside out, your skin may make up by either 4 or 5 layers. And the one that makes up 4, we call that the thin skin. The one that makes up 5 layers is called the thick skin. We go to more detail than that. Right now, all I ask you to do is get used to the name. From the inside out, the deepest layer is called stratum basale. The term basale tells you is the base, right? And then you have stratum spinosum, and then you have stratum granulosum. On the skin layer, they have 5. You have this layer in addition. We call it stratum lucidum, and then the outer layer, stratum corneum. Remember, on the thin skin, there's only 4 layers. Lucidum is not present. Now you learn that already, let's take a look. Okay? And what I'm going to do this, so you guys know. Because if I had to go back and forth, you see on this slide, we go to each of the layer and tell you which one it is. Are you with me? And I have to flip back and forth, back and forth. So why would you do that? I'm going to use this finger right here. To lecture all of them, and then you can give the detail later. But right now I'm lecturing, you can flip back and forth and see what layer it is. But we should learn that we have 2 types of skin, thick and thin. So when the body is thick and when the body is thin, and this blue man's figure right here, and you right there, really remember that. The only area of your body that have the thick skin are the palm of your hand, the anterior surface of your digit, and the sole of your foot. Those are the only skin area that you have 5. The rest of your body, there's 4. And that's why I tell you right there, okay, the palm right there, and they should have the roof right here. And then you see over here, the rest of the body, they are thin skin. Are you with me so far? You know me already that I can ask you a simple question by I give you the name of the 5 layers, list them in the order, either from outside in, most superficial to deep, or deep to superficial, right? Sometimes I get creative. Sometimes I say, I don't like who I don't like, who I harass already. You think so? I think I know I harass. Right? Who will have to do the first row first? Do you have a right here? Who have a right here? But that's okay. Now, okay, I don't like her. Right? So I come over, I take a real long needle, and I say, you ahead. And then I poke the needle into the tip of her septum digit. Okay? Can you tell me in the order from the superficial to deep that I have the needle have to go through? Can you see that I asked for the symptom, right? I should make up stories for it have little salt and pepper in it, right? I asked for the same principle. Does it make sense? So what layer do you think the needle touch first? Corneum, right? And then you know the rest. Okay? However, I can say, oh, I don't like wind, so I now just finger with you all the time, right? How about I poke it on the back? Right? Now here's indicate. The tip of my needle right now is on the 3rd layer. What layer would that be? I poke in on her back, and the needle now is in the 3rd layer. Okay, easy example, third or fourth, we have to know, is that 4 layer or 5 layer? 4 or 5. After all this, and you still tell me the back of the skin on the back is 4 layer? You say 3 layer?
Two, I'm thinking because not the things because they're so skin. So
No ma'am, we only learn. The only thick skin in your body are where?
when you're that's why when you want to go through the back,
Yeah?
you're not going to touch the second.
Oh, you go the long way, young lady. How about it? Just can be thick or thin? I disagree. Right? Never mind. They are not from the full level. Of course, it's thin skin, right? So now in thin skin, actually you have the tip of the middle is on the third layer. What layer would that be? So the first one is corneum. The second one is no, remember in thin skin, there's no lucidum. Pilosum, and then the third one is spinosus. Makes sense, right? So absolutely, Dr. Wu, you are right. But the third can be came from you can count from Basali, so the third one should be pilosum as well. Let me say that. I look at them and say, you are right. But where do you see people poke at you from the inside out? No, you're only just flash, right? Okay, so that's why during the lecture I usually throw out those questions you see that mentality I have in mind to ask you the question, right? The principle is the same. It's just how I ask that you guys don't like. Because sometimes it's not straight and forward. Sometimes I twist and turn a little bit, you have to think a little bit. Right? Okay, so now we go back to this. We go with each of the layer and we learn their component. And right here, they show you on this side an actual beautiful, well-defined drawing, and they show you the actual histology of the skin. Can you see all the layers still there? Alright. So right here, the deepest layer is called stratum basale. If I ask you what are the major type of cell found in this layer, the answer is keratinocyte is a major type of cell. Right? Okay, every time that everywhere, any label you're looking at, keratinocyte is the most abundant. However, when you look closely, you can see right here, in addition, and by the way, the stratum basale is made up by a single layer. You see right here? Okay, so this layer is not typical stratified, it's actually simple cuboidal. The name of this layer. Mingle with the keratinocyte, we have this cell right here, look what I want. One of them in blue color right there, the cell in your book is called tactile cell, and we got to learn a specific name. That cell is called the Merkel cell. The Merkel cell is the cell that detects touch. When you cut the skin, those are the cells that associate with your nose, and that's how the nose is going to be touching you. If you go along right there, you see another cell right here, and that cell is called melanocyte. And you know, inside this cell, what do you call a cell? Melano. Because this cell produces a skin pigment named melanin. And we're going to, in a couple of slides later, why we need this melanin. It's a skin pigment that ranges from light brown to dark brown. Okay? Why we have that melanin? Say that for a while. So, together with the keratinocyte in the stratum basale, you also found Merkel cell and melanocyte. Okay? And then, let me pause. Your textbook also mentioned this as well. Some other textbook, instead of using the term stratum basale, it actually called germinativum. Now the term germinate reminds the verb name germinate. When people put a seed under the ground, the seed germinates into a small tree. Remember that? What do they call this layer? Germinativum. Okay, let me show you a very sad lie of keratinocyte. Okay, all keratinocytes that found in your epidermis, they all born in the stratum basale. Okay, and then after they born, they grow the big cell divide and they push into the spinosum. I call them, that's where they become mature, an adult keratinocyte. And then by the time the keratinocyte push into the granulosum, they are in nursing home. Okay, they're about to check out hotel block. And then when they finish, they be pushed through the lucidum into the corneum. What you see in the corneum is a big, gigantic cemetery. Because all of those cells found in your corneum are dead cells. That's why, how many times I tell you guys every day you lose about 80,000 cells in your skin? Good news is that those are dead cells. Okay, and then dead cell, that's why we don't care about them. We can afford to lose that much. That's also the reason why the cell found in basalt, okay, has the highest mitotic rate compared to the other layer, because all the cells will be replaced by the cell divided from the basalt. Right, the dividing core cell is push up, the flower, the new cell, and push up, and that's why they also known as filament epithelium, which is the layer that divide to all the other cells in the superficial layer of the epidermis. When you move on into spinosum, okay, you notice that right here they no longer a single layer. They make up by between 3 to 5 to 6 layers. That make up spinosum. The name spinosum originated from, you look at the cell right here, you see all the things sticking out on the membrane right there? Okay, like a spine sticking out, in the term spinosum. And then by the appearance, what are the spines sticking out? The spine that's sticking out not right there is actually the melanin pigment. They pack together and they put on the membrane. And that's why they call that spinosum. When spinosum moves into granulosum, can you see that the cell now becomes more flat? Okay, when it becomes more flat, the melanin pigment now no longer packaged into that spine structure, but now they broken down into little small, we call it granule, little dot we find inside the cell, in the term granulosome, short for granule. Okay, and then when they push up into the lucidum, in the Blitzkrieg or corneum, that's where they all dead cell. And you notice that? Do you see any nuclei on the corneum? Of course not, because they're all dead cell. All the nuclei have been destroyed already. Okay, and that's what it is. Okay, you see how clever we are? And by the way, can you see the multiple layer found in your corneum compared to a solid, a single layer? The multiple layer is for protection, right? And not only that, they have multiple layer, they all dead cell. So any kind, your skin is your first line of defense. So any chemical insult, any physical insult, it is a dead layer cell that suffers from that. Good, that's what we put a dead cell in, like a physical barrier. You make sense of that? Okay, so those are the seven flower. So your function is know the characteristic of each layer and their function. Let's we start one time. In addition to the keratinocyte in the spinosum layer, and you notice the cell level yellow color here. The name of the cell, about 5 years ago, the name of that cell is called Langerhans cell. You will hear that name over and over on the next chapter as well, because Langerhans is the name of very famous histologist. Okay, and they usually name the cell after the guy who's discovered. Okay, you see that many of them they have the name associated with that. Langerhans cell is one, multiple cell is the other one. However, the function of this cell is not well known before. 5 years ago, one of the professors at UT Southwestern in Dallas received a Nobel Prize for study of immune system, and this cell is one of the important cells in the immune system. And that guy, the guy who received the Nobel Prize, named this cell, not Langerhans, he called it dendritic cells. The reason why he called it dendritic cell, do you remember the term dendrite? When we study the neuron, the cell different, okay, because the cell only has a bunch of process sticking out, okay, they call dendrite. This cell will resemble that right here. That's why we call it dendritic cell. In honor of he received the Nobel Prize, they changed the name into dendritic cells. So now the most common known as dendritic cell, not dendritic cell. Okay, long story short, what the heck does it do? According, it is your local cup, local enforcement, law enforcement. Yes, thank you. Have you noticed that all the important facilities, including Arlington City, we have Arlington Police Department, right? Arlington PD. However, each important facility have their own security. We do have our TCC policemen for our own, right? You go to the bank, there is a security for that bank. So have you noticed that the common thing, the important structure, we have extra security. Are you with me? Well, this guy right here, the village cell, is that specific security because this cell will only stay in epidermis. They say that it only stay where it's supposed to be, if your line protection. Does the term phagocyte ring a bell? What's a phagocyte? The cell eating. Now, if that's the case, does the name macrophage ring a bell? Macrophage. This is when we talk about different cells can be found on the connective tissue. Okay, macrophages are the unique specialized white blood cells, and they use the term the eating green machine. This guy protects you by eating the enemy up. Well, turns out there are two types of macrophage. Okay, one is called fixed macrophage, fixed macrophage, and the other one is wandering, wander. Okay, macrophage. The name tell you right there. What do you think when you call it macrophage? Wandering macrophage or wander macrophage? They're wandering around. We're wandering around the tissue. Right? We have fixed macrophage. They stay put where they are. This one here. The macrophage that found in your blood and macrophage that travel throughout the body tissue are the one macrophage. Then this is a fixed macrophage. Why is it fixed? Because it wants to stay in your epidermis. Okay? The function is to protect your skin. When you have invaded a curve, that is a cell that will go and perform cytolysis. So don't, that actually give you life. When I picture right there, cover all the slides you see right here. Okay? And went through each layer and discuss the cell type, and so on. So you can cut off. Now, one thing we have to care about the most is the color of your skin. I'm not talking about the color that's telling you the different anything from. In medicine, some color of the skin tell you the whole story right there. So when you walk into the doctor office or when the doctor enters the exam room, okay, when he say hi, look at you, your skin color may tell him the story already. So it is pertinent for us to understand what the skin tell you. Before we can talk about different and not only the skin color, let's talk about what contributes to your skin color. There are different kinds of pigment. There are three major pigments to be exact. The first one that contributes to your skin pigment is called hemoglobin. The name tells you already. What kind of pigment is this? And they are very obvious in the Caucasian, right? Their skin is lighter. Okay, this is the color of your blood, red. Hemoglobin. And under your skin, they appear to be pinkish because of that. That's one color that can contribute to your whole skin complexion. The next one is melanin. Okay, melanin is a pigment ranging from light brown to dark brown that releases from your melanocyte. Now we talk about why we need that. Hemoglobin, the pigment came from the color of the oxygen carrying hemoglobin. But melanin present to protect you. Every single day, the sunlight will come us. There are different kinds of light rays. Okay, and there's certain types that can damage your skin. We covered them already. They're called UV light. Okay, now there are two types of UV light we mentioned later in the 10 area. They're called UV light A and UV light B. Whatever they are, they can damage your body. And that reason that we have melanin. Melanin, you almost like when you drive a car, you so most cars have a team window. So melanin functions like a team window that covers your skin, so that when the light strikes your skin, it reflects back. So that it won't damage the cell of your skin. That's why we need melanin for protection from the light. Amy so far? And here's a story that I read anytime about 6-7 years ago when I finished my statement and I did you that melanin functions to protect you. And melanin is a major pigment that constitutes your skin color, right? And I had one of the after melanin student who sit right next to his friend, which happened Caucasian. And he looked at me and said, Dr. Wu, you mean to tell me that I'm much more protected from the sunlight than this guy? What do you think?
Yeah.
Yeah? That yeah is not confident, young
Yeah,
lady.
it was. That was like a dub, like a yeah.
Oh, that's the dub. That's the dub, obvious. You absolutely correct. Absolutely correct. The element is there. Less than 5% of all cancer, skin cancer, contribute to African American. 95% is who it is. Caucasian and other skin color. Tremendously is Caucasian. Okay? And that's why people remember people say that evolution is evident by that. And you know that people who live on the area where there is no protection like the shading or the equator, okay, the skin is darker because of that. So it's showing you right there. And the answer is absolutely. And the other guy, his friend, too, said, okay, fine, I still have some love. And you said, right? Okay. Oh, as a matter of fact, another thing came out on that is because the skin color, is divided into 3 groups, right? Dark skin African American, light skin Caucasian, and someone between East Asian. Make sense? The people say, oh, this study came out, maybe the darker skin because they have more melanocytes. That makes sense, right? The more melanocytes you have, the more money you have. So this study set out to try to estimate the number of melanocytes on the skin across ethnic group. And the way came out is there is no significant difference in number of melanocytes across ethnic group. So how the heck is one skin darker than the other? We found out that it does not matter how many melanocytes you have. It matters how active they are. Make sense? Okay? The more active you are, the more melanin you produce in your skin darker, not the number of them. And that's why it came out in that study. Cool. All right. Now, so you learn two pigments, right? Melanin is the major one, and then the hemoglobin. The third one is the yellowish color that sometimes you see when you have light skin. We call that keratin. Okay, keratin is an orange-yellow pigment that usually came from your vegetable, and that's why sometimes you see kids.
Sorry, I'm
Okay.
sorry. I'm sorry.
What did you just say?
Nothing. You talking about orange people, right?
There's a lot of people.
Well, I was comparing it to Donald Trump. That's why. That was the first thing that came to mind.
Oh, I'm with you now. I'm with you now. Tell you the truth, I have no clue what he is. Yeah, it could be official. I don't know, but let's go back to this young lady.
Okay.
Yeah, you can send that to the person and say, tell me what your true skin color is. That was the accent. Okay, but no, you know, actually, you guys, your skin pigment based on three of them together, not just one. Okay, the yellow orange color came from the vegetables. Okay, I know that because I can see what kid eat a lot of carrot. You see me, folks? And now you can buy fruit in the jar, and 2 years will come over. They look literally a small carrot. The skin color looks like that. And that's an example to you guys that came from vegetable. Okay? And it has yellowish color like that. Now, in this case, though our vegetable that we encourage you guys to feed the youngster is the one that produces vitamin A. Okay, and what we need vitamin A for? First one, you heard that for your vision. Okay, vitamin A is important for your retinal cell. Second one is also good for your free radical. Remember free radical that your peroxisome have to remove. Peroxisome is the organelle in the animal cell, and last but not least, okay, vitamin A also plays an important role in the immune system as well. And you can see that right now I stay very general because all the functions you learn much detail when we get into that chapter. So together, the skin pigment on our skin right now is a combination of those three colors. Okay, melanin, keratin, and hemoglobin. Okay, however, you can see because melanin ranges from light brown to dark brown, it is a dominant one. Okay, sometimes you don't see the other two. Now, why should we care about the skin color? Okay, here we go. But before you go in, let's talk about how the cell that we call melanocyte produce melanin. And here's how to produce melanin. One of those 20 amino acids that we will briefly introduce in the cell chapter, 20 amino acids, one of them is called tyrosine. Okay? In the melanocyte, there's an enzyme. The enzyme is tyrosinase. This enzyme takes tyrosine and converts it into melanin. So those where I put them, that's how the melanocyte make melanin. They take tyrosine, which is an amino acid, and convert it into melanin. The enzyme that is responsible for this is the enzyme named tyrosinase. These enzymes are light sensitive. The more light available, the more active they are. Oh, that explains things, isn't it? No wonder when I look outside, I expose the sunlight more. As you look darker, we call them a natural tan, isn't it? A natural tan because the tyrosinase become more active and produce more melanin. Okay, now, there is an entire dermatology, but I will use some of the skin disorder so that you can learn. The two diseases I mentioned just for fun. The first one is called vitiligo. Okay, this name associated with a very ex celebrity. You know who it is?
What's it called?
Vitiligo.
Isn't there like some discoloration of the skin?
That's not my question.
Oh, I thought that was the question.
My question is, this disease associated with a very famous celebrity who has passed away already? Michael Jackson. Right? Let's talk about what this one first. Vitiligo is where certain area of your skin become lighter. Those spots become lighter. Okay? And they become lighter because the melanocyte in that area either no longer produce melanin or they are dead. Make sense? That's why the skin appears to be lighter, and they most often occur in the face, on the chest, and on the lip. Okay? And well, that's the fact we know. But what causes it? Right now we don't know. Some say because it's caused by a virus infection, that a virus destroy the cell, because of a certain kind of disease. It is secondary effect. The jury is still out there. But what now is that low light area on your skin, and that's why the famous Michael Jackson story came about. Remember, his face is completely lighter than his body skin. Okay, so people ask them, he say, well, because he have vitiligo. The minute he mentioned vitiligo, a bunch of doctors say, yeah, right. Right? Why they say that? The reason is that because when you have vitiligo, you have little spots here and there. They are not evenly white like that. Are you with me? However, another theory say he had vitiligo. He did have those spots right there that look very attractive, so he bleached the whole thing up, even it up. You understand? Who's right, who's wrong? I don't care. But the story is good, right? They tell you about vitiligo. So any question with vitiligo? And by the way, sometimes it comes up, sometimes it goes away. Okay, sometimes the treatment to make sure that the nurture and the bleaching is one of them as well. Oh, how many of you guys heard the name albino? Okay, I have the albino rat. I have albino rat. Albino rabbit. And yes, human. We do have albino as well. And those individuals that appear to be white, not white Caucasian white, is abnormally white. We call that albino. Well, the disease is called albinism. Albinism. Okay, in this individual, it happens to be a genetic disease. Remember the enzyme that make your pigment named hydrogenase? Okay. That's someone like that? Okay. Well, we're going to go there. Hydrogenase. What is the major chemical makeup of an enzyme? And this is chapter 5. No, 4, excuse me. Chapter. What is the main chemical makeup of an enzyme? Start with the P. Protein. Protein. And you know how to make protein, don't you? The whole process we did, right? Transcription and translation. So because the enzyme is protein, this individual either completely do not have that DNA for this enzyme, or they faulty. Make sense? So the bottom line is this individual do not have the enzyme at all, or have the enzyme but not functional. That's okay. They don't have the capacity to produce melanin. And because the DNA is not therefore genetic. It was me. So that's why this individual has no protection at all. In Texas, you see them. I think we have a couple of our campus as well. When they walk out, they wear a big hat to cover their face. And then sometimes they wear a little mask to cover their face as well, and long sleeves, sometimes with gloves, because they have no protection. Not only that, have you noticed that the albino also have light color hair as well? What's that telling you? Your hair color also contributed by melanin as well. You know that? Okay? And also, where you observe the albino, eye color and light as well. What does that tell you? Melanin also makes up your eye color as well. Okay? This individual, they very have to be careful. So all of that, let's go back to this. Okay, cyanosis. Cyanosis is when your skin turns purple, you guys call it. Okay, it's easy to see. Just squeeze hot in your finger and notice the color of your fingernail. They change from pink into blue. Okay, and usually we find people who came from the outside that is cold. When they come in, you see the lips purple. We call that cyanosis, which is indicative that your blood does not receive enough oxygen. Your function is why? Whatever that is, you make sure that the oxygen now has to enter your blood before you treat anything else. And that's why nowadays, one of the reasons why, in addition to the fact for vital sign, blood pressure temperature, heart rate, and respiration rate, we also have oximeter. They clip your finger and they tell you saturation of oxygen because of that as well. That's why for the patient could make yourself.
That's common in newborns.
No,
No, maybe like the
it's not common newborn. If the newborn came out blue, that's not common.
or like hands kind of.
Yes, it may be, because when it came out, remember circulation not right there? But you guys, if the baby came out, they have the right there, you better react right here, something wrong. Yes, and usually we see that on still, it came out, yeah, it is. That's what you say common, say, I hope not, but yes, yeah, but yeah, sometimes if you come out either, sometimes, you know that little small, uterus in there, sometimes they can twist and turn, so sometimes circulation not there. So the good news is when they came out, you can fix that. But if the whole body is blue, oh, that's not good sign. Okay. All right. Erythema. You know this already. Erythema. Come on, the name sounds familiar, isn't it? One more time. Tell me 4 signs, symptoms of inflammation. Red, heat, pain, and swelling, right? What is sign pain for red? Erythema. Okay, erythro means red, and erythrocyte, right? Erythema means your skin become red. What does that tell you? Whatever that is, the blood now outbursts into a specific area of your skin. Could be injury, it could be inflammation, something tell you that there's something there. Okay, next one, jaundice. Okay, jaundice is a yellow color on your skin, and then most noticeable on your fingernail and your eyeball. Okay, this is where when you see somebody have jaundice, it's indicative of liver disease. Yeah, so the liver, and most commonly it's caused by excessive accumulation of one of the proteins produced from the liver named bilirubin. Okay, that's another. Can you see why the skin is important? It tells you a story. What do you see right there? Next one is the bronze. You all know have male. The bronze color is a shiny dark brown color. That's how I describe it. There's some people their skin turn into that bronze, almost like a car with a shiny layer right there. And that is indicative of very common hormonal imbalance disease associated with your adrenal gland. The name of the disease is Addison disease. You learn detail in AP2. Last but not least, hematomas. Hematomas is a fancy term for bruise. Okay? When you hit something, you see a bruise right there, and where's that bruise occur there? When you hit something really hot, the capillary that contains the blood inside busted. So now the blood now sitting out into that blood vessel. If they go down, in the blood we have a bunch of protein called the clotting factor, but if you're out, you look at this skin, those are the blue color before I have the bruise right there. That is hematomas, the bruise. Okay, so the bottom line is all this right here tell you how important it is to look at the skin color. You need to know that for your kid, for your significant, and yourself as well. You know your color changing. Always ask the question. There are many, and only I can mention, okay, right now, because the book has actually mentioned that. Nevus. Okay, nevus is basically a scientific term for mole. We all have mole somewhere, right? Some small, some big. Mole basically, the area where the melanocyte produce more than the other area. They will be darker. Sometimes the cell divide more, so not only you see the dark area, the mole also sticking out as well. The normal mole. Rarely the mole becomes cancerous. However, that's why you have to know your body. Okay, if you have the mole, for example, the skin right here, yeah, that's my the way I born with it. But suddenly you see that mole changing shape, changing thickness, and then you should consult not the right way. Because the right sign that it no longer innate mole already. It's still a sign of the cancer occur. Freckle is another variable. It's normally the melanocyte distribute equally throughout your body. But what happens in freckle is the distribution is not equal. Some more than the other, therefore the accumulation melanocytes are different as well. So not go throughout the body before that freckle. Okay, which is innate, we don't worry about that. Here are some extreme cases that we may talk about the skin as well. Okay, what did I tell you? Every time you have a disease, they have the term "oma" at the end. What does that mean? Cancer, right? In this case, where the cancer came from, the name is hemangioma. Hema means blood, angio means blood vessel. So in this case, it's caused by the cancer cell around the blood vessel. There are different types. I'll show you 2 common ones. Okay, you have probably heard the term strawberry colored blood clot. Okay, or you have caught while standing. Okay, see what it's wrong? Okay, well, let's go back. There are two types I mentioned, the capillary hemangiomas right here. In this case, that's a pill right there. They are came from the capillary and they just produce more cell blood vessels, therefore they produce out your skin. We call it strawberry color blood. This commonly go away when you reach top year, they go away. Sometimes they stay, but they shrink a little bit. Okay? Normally, unless they occur on the face or somewhere that, especially in girls, removal is required, otherwise it will leave it there. That's why they put a blood to leave forward. However, the second one, named cavernous hemangiomas right here, they actually occur in the blood vessel located deep in your dermis layer. It can be horrendous. And the example you see right here, that is a typical of cavernous hemangiomas right here. And now in this case, because it happened to a girl, surgery is one of the options to remove them. However, anytime you have surgery, I don't care how routine, how easy they are, any surgery induces a risk. Okay, and that's why sometimes people actually remove them and they actually activate and become actual cancerous. Okay, so therefore you have to consult a doctor with your option. Now, in some cases, you have a girl. I would say this, the parents said, I don't care what it is, remove them. Because the psychological effects are as bad as the physical effect. Especially kids nowadays. When you go to school, you have that. Okay, that's why we have people who commit suicide because they're not handled. Word can kill. It's the other word, just word I said. Well, some word actually kill people. That's because when it comes in, you are freak, you are not supposed to be human order. When they kill each other, have a more lasting impact than you think. That's why they don't want that the surgery is removed. Otherwise, you can snap it down. It looks like that. This is a replay now. So now you can see that, oh, not concerned about your nose. My nose is not funny, who cares? You have a nose. All right. Another structure you can found on your skin that is commonly known as a fingerprint. Okay. The actual name we call them the ridges. Now, if I draw your intestinal system, the normal intestinal system should show you something like this. Okay. Here is the surface of your skin, and then this is the border between your epidermis and the dermis. Right? We know that. Well, some area of your body, the outer layer are not flat like this. It actually follows the convoluted line of the border between the epidermis and the dermis, something like this. Here's the border, and then the outer skin looks like this. It follows. And that's why they create no ridges on the line. And they only occur in certain areas of your skin, you know, your fingerprint, right? The toe, the palm, and your finger. Those are the ones that you find the ridges. The question, okay, I know the structure. Why do we have no ridges? And right now, the only thing that we think about is, you see that every time you have something, you rub on something, might have the rough surface, you grab much tighter, right? Okay, that's why the same thing we think that we have that because we are very skilled with our finger, so it's easy to grab onto because of that right there. That's the only explanation why we have that. Besides that, we also use that for fingerprint. You know, you different than the other. Before DNA, even on the picture, we use that for identification. Well, we also know that one thing I'm afraid of most is people who are crooked, but they smart. Some criminal actually use the same type of special sandpaper, sand out their ridges. So when they hold something, the gun or something, they cannot find a very reliable fingerprint. Talk about those extreme to be a crook, huh? All right, any questions so far? Here's a typical pattern of your fingerprint. Okay, it's a good time to talk about the UV light. Okay, it turned out that the UV light short for ultraviolet. There are different subdivisions of it. In general, we divide it into two types: UVA and UVB. UVA, commonly known as a tanning UV light. What it means is that it will increase the activity of the tyrosine, but it does not become harmful. It will not create a burning sensation if you overexpose in the sun for tanning. Where UVB is the one that